Good morning, ladies and gentlemen. My name is Kevin Rappe, and I shall talk about the negligence regarding wrongful birth, a topic that piqued your interest as stakeholders. My presentation will be split into three parts. Firstly, I will introduce the topic of this presentation, which is negligence regarding wrongful birth cases. My central argument is that damages should be made available to the plaintiff because of the negligence of the defendant. Secondly, I will discuss the parents, you, the interest stakeholders in these cases, as they are the plaintiffs regarding wrongful birth. I shall talk about the importance of the doctors in the medical field, their duty of care that the doctor have to the patients, and how their negligence will affect the parents as the plaintiff. Finally, I shall talk about my suggested recommendation for further reform regarding negligence in wrongful birth cases in Queensland. Wrongful birth is a term used to describe by parents that negligent advice or treatment has deprived them of the choice of avoiding conception or of avoiding a pregnancy. The cause of action is that of negligence from the doctor. Research done by Sonia Allen and Meredith Blake, two taught experts, has stated that wrongful birth cases can arise from any of these things. Firstly, the negligent performance of a sterilization operation. Secondly, negligent performance of abortion resulting in a continued pregnancy. Thirdly, supplying defective contraceptive. Fourth, failing to advise about the risk of contraceptive failing to prevent a pregnancy. And last and fifth is the failure to diagnose a condition in the fetus that, if known, would have allowed the parents to decide to fully terminate the pregnancy. Currently, the leading authority of wrongful birth cases in Queensland and Australia is the Katanak and Melchior case. In the case of Katanak and Melchior, the plaintiff have two healthy children and have decided not to have any more. Mrs. Melchior, the plaintiff, did not wish to continue taking oral contraceptives, and when her husband would not get sterilized, she decided to undergo the sterilization process herself. She consulted to Dr. Katanak, the defendant, and informed him that when she was 15, her right fallopian tube has been removed. The defendant accepted his patient's assertion and did not investigate it any further. He also did not warn her that, if she was wrong about that, there was a risk that she might conceive. He subsequently only attended to her left fallopian tube in the sterilization operation. Mrs. Melchior subsequently fell pregnant and gave birth to a healthy baby boy. The plaintiff, the parents, claimed damages from the defendant, the doctor. The damages were the cost of raising and maintaining the child to the age of 18, for loss and damage caused by the pregnancy and the birth, for Mrs. Melchior, and the loss of consortium, for Mr. Melchior. Do you see the issue here? Not yet. Well, let me explain further. Research by Sonia Allen in her webpage states that, regarding wrongful birth, the Queensland legislation does not allow the court to award damages for economic loss arising out of the costs ordinarily associated with, firstly, the rearing or maintaining a child as a result of a failed sterilization process, secondly, failed contraceptive procedures, or third and lastly, contraceptive advice. It also does not allow for claim for cost up to and including the birth for antenatal obstetric and labor care. Lastly, it also does not address a right to claim cost for rearing a disabled child. Another case regarding wrongful birth in Queensland is the Fibers and Connolly case. In that case, the Supreme Court of Queensland has previously found in favour of a plaintiff mother after her doctor had failed to diagnose her with rubella and warn her of the consequent risk to her fetus, who was born with a severe disability. The judges in that case deemed that damages should be paid by the doctor due to his medical negligence. The legislation is unfair to the parents, you, because a doctor has a duty of care to the patient. A doctor should have foreseen that their conduct could result in harm to the plaintiff. Regarding wrongful birth, the doctor would have to see that the potential risk is not significant. It is foreseeable and that a reasonable person would have taken precaution. In the Fibers case, the doctor did not diagnose the plaintiff rubella, and thus the child was born with a severe disability, which then created harm to not just the plaintiff, but also to the unborn child. If the doctor is negligently in failing to warn the plaintiff of inherent risk, such as in cataract, then he is guilty of breaching the duty of care that he has on the patient. In the case of Fivers, he had failed to warn the plaintiff adequately or at all of the dangers involved with the pregnancy. As doctors, a higher standard may be owed. They hold themselves out for having special skills, special knowledge, or special expertise. Thus, for doctors to have negligently done their job, as evidenced in the Fivers and Katanak case, then the doctor must warn of the patient of the risk in the procedure. If the doctor has failed to give the patient the following information about the risk, then they have failed in their duty of care. Thus, it is only fair for them to pay damages to the plaintiff. My suggested reform in this presentation is from research by Amy Lee Soren and Norm Gere, two health law experts. The reform is to allow the defendant to be able to pay damages for the negligence to the plaintiff. An example would be the legislation in the New South Wales and in South Australia, where the legislation allowed damages if the child is born with a disability as a result of the doctor's, the defendant's, negligence. It would also be consistent with the overseas legislation, such as in France or the United States. In the Vibers case, Justice de Jersey awarded general damages of $50,000 to compensate the mother of a severely disabled child. The award was for pain and suffering, loss of amenities, and for the anguish she suffered during the pregnancy and because of the birth of a gravely handicapped child, and through her subsequent care of the child, which will continue. Thus, this shows that before the legislation has been passed, the court has previously passed judgment to give damages to the plaintiff from the negligence of the defendant. However, the current Queensland legislation prevents that with the Civil Liability Act 2003 Queensland Section 49A and Section 49B prevents that. The current legislation does not permit any damages to be awarded from any medical negligence from the doctor regarding wrongful birth cases. In CSR and Eddy, Chief Justice Gamow and Justice Hayden confirmed that a plaintiff who sued for negligently caused personal injury was traditionally only able to recover for three types of loss. These include, firstly, the loss of earning capacity from the date of the incident. Secondly, the financial loss from ambulance, medical, rehab, future costs, and non-pecuniary losses, including pain and suffering. Third and lastly is the capacity to engage two hobbies. Chief Justice McHugh and Justice Gamow brings the claim for the cost of child rearing is within the third category as a form of actual financial loss in Katanak and Melchior. If we were to apply to the Katanak case, then the Melchiors were awarded an amount of damages which also had three components. First, it was an award in favor of Miss Melchior for an amount of damages associated with undergoing pregnancy and childbirth, which includes pain and suffering and loss of earnings due to thrombosis associated with the pregnancy. The second, it was an award reflecting the husband's loss of the consortium. The third and last component was for the cost that the couple had and would incur in raising their son. Amy Lynn Soren, citing from Justice Kirby in the Katanak case, wrote that Whilst claiming damages for the creation of the parent-child relationship is incapable of rational or fair assessment, the claim for damage for rearing the childbirth is fair, as stated by Justice Kirby in Catanac and agreed by most courts all around the world, such as in France and the United States. In conclusion, Justice Hayne had stated that the recovery of damages for the cost of rearing a child should not be permitted. Although some extra cost may be recoverable where the child has abnormal or special needs for expenditure or maintenance, as he stated in the Catanac case, which would follow through with the New South Wales and the South Australia legislation. However, since then, and the Queensland Parliamentary Library research has stated that there has been zero judgment of monetary damages have been awarded by the judges regarding wrongful birth since the legislation was passed. This is due to the legislation dissuades judges from rightfully awarding money to the parents that are affected by the doctor's negligence, whereas it is more lenient in other courts in Australia. As a doctor, a high standard may be owed as they hold themselves as having special skills, special knowledge, or special expertise. Thus, for doctors to have negligently done their job, as in the Fivers and the Catanac case, and regarding wrongful birth in general, it is only fair for them to pay damages for the pain and suffering to the plaintiff.